हैरत है तालीम और तरक्की में है पीछे। हैरत है कि तालीम और तरक्की में है पीछे, जिस कौम का आगाज ही इकरा से हुआ था। So today we are going to talk about restrictive lung diseases. Previously we have talked about the obstructive lung diseases. So what is the main difference between the obstructive and the restrictive lung diseases? In the obstructive lung diseases, there is the obstruction while movement of the air from the environment into the lungs, and also the obstruction when the air is moving out of the lungs. There is more obstruction for the movement of the lung, while in case of exhalation, means when you are moving the air from the lungs to the environment, then there is more obstruction of the air in the lungs. But in case of restrictive lung diseases, there is a restriction for the movement of the lungs from the environment into the lungs. Due to what? Due to the low capacity of the lungs, due to the reduced lung capacity. This is the normal lung and this is the restrictive lung disease में यहाँ पे जो है ना lungs की क्या हो गई है, फिब्रोसिस हो गई है, ठीक है. So this is the restrictive lung disease. In this case, the total lung capacity of the lungs is decreases. So that's why air cannot move from outside into the lungs. But in this case, the total vital capacity of the lung is not decreases. In case of obstructive pulmonary disease, in that case, there is an obstruction here, mainly in the major airways. In, for example, bronchi and bronchioles. But in case of restrictive lung diseases, there is a major obstruction in the alveoli, mean the distal airways, the small airways. Okay. So, what are the restrictive lung diseases? These are the interstitial diseases. Why I am calling the restrictive lung diseases the interstitial diseases? Because there is a between the adjacent alveoli there is a space known as interstitium, and in this space when the scarring occur, when the scarring or fibrosis occur, there will be the reduced lung capacity. So in this case, the air cannot move into the lungs. Okay. So restrictive lung diseases are those characterized by the reduced ability of lungs to expand. In case of restrictive pulmonary disease, there is a reduced capacity of the lungs, mean the forced vital capacity decreases. Mean the forced vital capacity decreases. And we have discussed that in case of obstructive lung diseases, the forced vital capacity decreases or increases? Increases due to the overinflation, due to hyperinflation of the lungs. When the air move inside the lungs, then air cannot easily move out from the lungs. In case of asthma, in case of emphysema, okay. So in this case, the lungs become more inflated. Okay. So force vital capacity increases in case of obstructive lung diseases. And in case of restrictive lung diseases, it is decreases. And we have discussed that during spirometry, this is the force expiratory volume in 1 second. So during spirometry, the pulmonary function test, the ratio between the force expiratory volume in 1 second and the force vital capacity during restrictive lung diseases, this ratio decreases or increases? Here is the denominator decreases and the numerator, no, numerator also decreases, but comparatively less decreases. So in this case, the ratio comparatively increases because denominator is decreasing, okay, and comparatively force expected volume in 1 second is less decreases. So in this case, in restrictive lung diseases, during spirometry, the ratio between force expected volume in 1 second and force vital capacity increases. This value increases in spirometer. And in case of obstructive lung diseases, this ratio increases or decreases? Decreases because denominator is increasing. This is the main difference. So when a patient comes to you in an emergency in your clinic, then how the patient is suffering dyspnea and shortness of breath, and patient is in severe condition, then how you can distinguish immediately that this is the obstructive either restrictive. If you do the spirometer, then spirometer will clearly tell you that it is either obstructive lung disease, either restrictive lung disease. Okay. After that, you will further investigate that in restrictive which further disease you can differentiate. Now we will talk about the four major categories of restrictive lung diseases.